I'm Dr. Carla Sommardahl, and I am an internal medicine specialist in equine at the University of Tennessee Veterinary Medical Center. So blister beetles are a beetle that infests or nests in alfalfa hay, and they are more prevalent in the western part of the United States, sort of west of the Mississippi, Midwest too, but anywhere that alfalfa hay is grown, there is a potential that they could come and nest in the growing hay. That is just their preferential source of food and nesting material is in alfalfa hay. And it could also be in a mixed field where you're growing alfalfa and grass hay and baling it for feed. So things you can do to make sure that your horse is not going to come in contact with these beetles is to obviously know your source of hay, and you can buy Blister Beetle certified free alfalfa hay or alfalfa mixed products, so you know your grower. Sometimes they say that first cuttings of the hay will be less likely have the beetles in it because it's grown earlier or cut earlier in the year, and the beetles may not have had time to nest, but that's not always a guarantee. So the best thing to do is just check your hay, and you need to check every flake, unfortunately, because it can just be in one part of the field where it was cut. So just part of the cutting may have the beetles, and the rest of the field may have been fine. So it varies, but inspect every flake of hay that you feed your horses, which I know can be sometimes a lot more trouble, but to protect your horse, that is really the best thing to do. So blister beetle has a toxin in its body, and the toxin survives even once the beetle is dead. So the beetles are actually dead in the hay, so you'll find the dead beetles. So that toxin is called cantharidin, and that substance is very irritating to the membranes all the way from the mouth all the way down into the digestive tract. So they may colic, which is sometimes the first sign we see. Then the toxin also is cleared by the kidneys, and this toxin is very toxic to the kidneys. So that leads to the more deadly problems that we see. So they'll just be very colicky, they can be depressed, just sick acting, have maybe frequent urinations because it's irritating all the way down the urinary tract, so they may act like it's painful to urinate. So those are all the kind of progression of signs that we will see in a horse. Now obviously anytime a horse is colics, if it seems to last longer than just a little bit of colic, and you should contact your veterinarian. And if you are feeding alfalfa hay, obviously you would maybe want to look out for these signs because it may be cantharidin or the blister beetle toxicity versus another form of colic, and just contact a veterinarian to have them look at the horse and obviously check the hay that the horse has been eating. So we actually will collect urine from the horse, and we send the urine to a toxicology laboratory in Oklahoma, and they will test it for the toxic substance. Obviously that has some time delay, so we will treat, and there's not a specific antidote for this, so it's very just symptomatic treatment and trying to protect the damage and prevent any more damage that has been done. We will give them fluids, obviously, to flush the kidneys out and get rid of the toxin quicker if we give them lots of fluids to help do that. And then we'll give them gastric protectants and intestinal protectants to help relieve some of the irritation that has already been done by the toxin. And then sometimes these horses have electrolyte abnormalities because of the intestinal irritation and because of the toxin itself. And we will supplement those electrolytes in the IV fluids while we're giving them. We have a description of this problem on our website, and also you can contact us if you have any questions, or contact your extension agent for help in looking at the hay if you have any questions, if your hay may be infested or not. And I actually have an example of the blister beetles. They come in different forms as far as species, but They're very small, so you have to really dig through the hay to see them. Some of their bodies are striped, so they're very tiny, as you can see. It's about the size of a little grain of rice. And but they are very common beetle shaped, and they will have striped wings, and some will just have plain black wings. So there's just different species in this same family. But they will, they'll cluster. You'll find clusters of them when in your hay, so they're not that hard to find if you dig through the flakes. So depending on how many they've ingested, just 5 or 6 beetles can cause the clinical signs in a horse. And if they've ingested more, then it is potentially deadly. You can, the treatment obviously will help prevent and save your horse. The quicker you treat and do the symptomatic treatment, there's not a specific treatment again, it's just supportive care. But the quicker you can get that supportive care, the more likely that your horse will survive.